What if I told you that one of the most powerful tools for managing your blood sugar isn't in a pill bottle, but in something as simple as when and how you drink water? I know that sounds too simple. You're probably thinking, I've been drinking water my whole life. How could that possibly help my diabetes? Or maybe you're skeptical because you've tried so many things that promise to help but didn't deliver. Stay with me, because what I'm about to share has made a real difference for hundreds of my patients. These are people doing everything right, taking medications faithfully, never missing a dose, following meal plans carefully, measuring every portion, checking their blood sugar multiple times a day, walking every morning, and still their numbers were unpredictable. Still they felt exhausted. Still they worried every time they got their A1C results. The frustration I see in my office is real and heartbreaking. People in their 60s and 70s who've been fighting this battle for years, sometimes decades. They've spent money on special diabetic foods. They've given up foods they love. They've done everything their doctors asked. And they're tired. Tired of the constant vigilance. Tired of feeling like they're failing even when they're trying harder than anyone else they know. I am Dr. Jonson Tery, and in my years of practice I've learned that sometimes the most powerful interventions aren't the most complicated ones. Sometimes it's the basics we've completely overlooked that make the biggest difference. Recent studies from major medical universities have shown something remarkable. Drinking water at specific times can improve your insulin sensitivity by up to 40%. That means your body becomes better at using the insulin it has, whether that's your own natural insulin or insulin from medication. The key isn't just how much water you drink, it's when you drink it and how you drink it. Small changes in timing can create significant improvements in blood sugar control. This isn't about replacing your medication or ignoring your doctor's advice. It's about giving your body the support it needs to work more efficiently. Write your country in the comments, and if you're new here, subscribe and turn on notifications. Let's talk about why this matters, especially after 60, and why your blood sugar changes after 60. Let me start by explaining what's happening in your body as you age, because understanding this makes everything else make sense. After 60, several things change that make blood sugar control more challenging. Your cells become more resistant to insulin, meaning they don't respond as quickly when insulin tries to deliver glucose. Your pancreas doesn't produce insulin as efficiently as it used to, so you're working with less of this crucial hormone. Your kidneys don't filter glucose as well, which means excess sugar stays in your bloodstream longer. And here's the part most people don't know. The part that surprised me when I first learned about it in medical school. Your brain's thirst mechanism becomes less sensitive with age. That last point is absolutely crucial. You can be significantly dehydrated, dangerously dehydrated even, without feeling thirsty at all. Your mouth might not feel dry, you might not feel any discomfort, but inside your body at the cellular level, things are going wrong. And even mild dehydration, just 2% below optimal hydration, which is barely noticeable to you, can raise your blood sugar by 10 to 15%. That's enough to take you from good control to poor control. That's enough to explain those frustrating morning spikes or unexpected afternoon highs that seem to come from nowhere. Let me tell you about David. He was 68, and I could see the frustration on his face before he even sat down. "Dr. Tery," he said, his voice tight, "I don't understand what I'm doing wrong. I'm eating carefully, measuring everything. I take my metformin exactly as prescribed. I walk 3 miles every morning. I've cut out sugar and white bread. I've done everything." He pulled out a notebook full of blood sugar readings. "Look, some mornings it's 140, others it's 180. Yesterday, 165. Today, 175. Same breakfast every day, same oatmeal, same portion. But the numbers are all over the place. His wife added quietly, "He tries so hard, but his A1C keeps creeping up from 7.2 to 7.8. We went through his routine. Diet excellent, medication timing perfect, exercise consistent. Everything looked right on paper. Then I asked what seemed simple. David, walk me through your morning from when you wake up to breakfast." I get up around 6:30, check my blood sugar, make coffee, drink coffee while reading the news. Then around 7:30 I make oatmeal and take my medication. "When do you drink water?" He paused, confused. "When I'm thirsty, I guess. Sometimes with my medication. Is that wrong?" There it was. David went from 6:30 a.m. until 7:30 or later before drinking any water. 8 hours sleeping, then another hour awake without hydrating. 9 hours total of dehydration. We made simple changes. Every morning before coffee, he drank warm water with sea salt and lemon. Before meals, water 15 minutes prior. He carried a bottle and sipped throughout the day. 2 weeks later he called. His voice was lighter. "My morning readings have been 125 to 135 for the past week, every day. That hasn't happened in 2 years. A month later, his average dropped by 20 points. No medication changes, just water timed correctly. "I thought you were crazy," he admitted with a smile. "Water seemed too simple. But I can't argue with my glucose meter. The numbers don't lie." Before I tell you the method that's helped my patients, let me explain the 3 most common mistakes I see. You're probably making at least one of these right now. Mistake number 1 is waiting until you're thirsty to drink. Thirst isn't an early warning system. It's an alarm that goes off when you're already dehydrated. By the time your mouth feels dry, your blood has already thickened, your glucose is already elevated, and your insulin is already struggling to work efficiently. Think of it this way. Your blood is like a river carrying glucose to your cells. When the river is full, glucose flows smoothly where it needs to go. When the river runs low, it becomes thick and sluggish. Glucose gets stuck. It accumulates instead of being delivered. Mistake number 2 is drinking large amounts all at once. Some people go hours without water, then drink a huge glass trying to catch up. But your body can only absorb about 200 to 250 milliliters every 15 minutes, about 1 cup. Anything beyond that just passes through to your bladder without hydrating your cells. It's like watering a plant. If you dump a whole bucket on it at once, the water runs off and the roots stay dry. But if you water slowly and steadily, the soil absorbs it and the roots get what they need. Mistake number 3 is drinking ice-cold water, especially first thing in the morning or right before meals. I know cold water feels refreshing, but it causes your blood vessels to constrict. When your vessels narrow, insulin has a harder time reaching the cells that need it. Room temperature or slightly warm water keeps your blood vessels relaxed and dilated, allowing insulin to work more efficiently. This is especially important in the morning and around meals when your body is processing glucose. Now let me teach you the method I use with my patients. I call it the H3 method. H for hydration. The first 3 represents 3 key timing points. The second 3 represents 3 essential elements. Timing point 1 is first thing in the morning. This is your most important timing point. The moment you wake up, before coffee, before breakfast, before anything else, drink 1 glass of warm water, about 350 milliliters or 12 ounces. Add a tiny pinch of natural sea salt, just what fits on the tip of a butter knife, and squeeze in fresh lemon juice, about half a lemon. After 8 hours of sleep, your body is dehydrated and you've lost electrolytes too. That tiny bit of sea salt provides minerals that help your cells absorb and use the water. The lemon provides vitamin C and helps stabilize your blood sugar response to your first meal. This morning ritual signals your adrenal glands to calm down, reducing cortisol release and preventing unnecessary morning blood sugar spikes. Patricia, 71, with type 2 diabetes for 15 years, dropped her morning readings from 160 to 170 to 125 in 3 weeks with just this change. Timing point 2 is before meals. About 15 minutes before lunch and dinner, drink a small glass of water, 150 to 200 milliliters. This prepares digestion and slows carbohydrate absorption, reducing after-meal blood sugar spikes by up to 20%. Timing point 3 is during activity. If you're active for more than 20 minutes, drink small sips regularly during the activity. Adding a bit of cinnamon during exercise can further improve insulin sensitivity. The 3 essential elements are temperature, minerals, and consistency. Room temperature or slightly warm water is best. Minerals matter, which is why sea salt is important. Consistency matters because your body thrives on routine. One more addition I recommend is a glass of warm water with magnesium before bed, which helps insulin function, sleep quality, and overnight blood sugar stability. To calculate how much water you need daily, take your body weight in pounds and divide by 2 to get ounces. Adjust for exercise and heat. Your urine should be pale yellow. Avoid coffee on an empty stomach, sodas, even diet, and distilled water. When you start this method, expect more frequent bathroom trips at first, then more stable blood sugar, better energy, and improved overall well-being within weeks. This is not a replacement for medical care or medication, but a way to support your treatment. If you have kidney disease or take blood pressure medication, consult your doctor. I challenge you to try this for 14 days. Follow the H3 method exactly, track your blood sugar, and notice how you feel. Small changes done consistently create real results. I'm Dr. Jonson Tery. Take care of yourself, and I'll see you in the next video.